Okay, good morning, everyone. I'm happy to see that everybody is coming in one after the other for this side event. You're welcome to the official side event of the CPHIA Conference of Public Health in Africa, anchored by the Sydani Group. And thank you so much for joining us. The first thing on the agenda is for us to have a national prayer, which is the second stanza of the national anthem. I'm going to ask that the media team please project that on the screen so that we can all take it together. I'd also ask that you please unmute yourself and we sing the second stanza of the national anthem together. Thank you. Okay, thank you, team. O God of creation, that are no guide our leaders right, in great love to Thank you so much, everyone. May God bless our great nation, Nigeria. So right now, I'm going to introduce the person who's going to take the opening remarks in person of our group managing partner, Mr. Sydani Sampson. I'd also like to read his, if you can show the next slide, please, Tim.
No.
So Mr. Sydani Sampson is a consummate management consultant, founder and global managing partner and CEO at Sydani Group. As a seasoned professional with several years of experience in health system strengthening and international development, please, if those who are not talking now can mute themselves, please. Sorry, is the technical team? Yeah, thank you. So again, I'm going to He's a consummate management consultant, founder and global managing partner, CEO at Sydani Group. As a seasoned professional with several years of experience in health system strengthening and international development, Sydani oversees the management of Sydani's diverse portfolio of projects and partnership, with lead responsibility for the firm's ongoing expansion efforts into emerging areas of international development. Sydani provides strategic and technical support to Gavi, the Vaccination Alliance on Immunization and Health System Strengthening Initiatives across the National Primary Healthcare Development Agency, the NPHCDA, and the Nigerian Center for Disease Control, NCDC. He has extensive experience managing international and country-level development stakeholders across global institutions such as BMGF, DFID, USAID, WHO, UNICEF, USCDC, EUSIGN, CHI, and IVAC, amongst others. Ladies and gentlemen, here is our global managing partners at Sydani Group. Unfortunately, he's not here for unavoidable reasons, and he's ably represented by Mr. Andikan Ibanga, who's going to take the opening remarks. Mr. Andikan, over to you.
Right, thank you. Thank you very much. Can you hear me?
Yes, loud and clear.
Okay, good afternoon, good morning, good day to everyone on this call. My name is Andikan Iba, and on behalf of the Global Managing Partner and CEO, it's a pleasure to welcome you to this webinar, Transitioning from Surge to Sustainability, an official side event of the Third International Conference on Public Health in Africa. This webinar is hosted by Sydani Group, and Sydani is a leading international development partner with a vision to set new standards of excellence in creating solutions to complex challenges in international development. At Sydani, we provide thought leadership and strategic consulting services to a wide range of clients, including national and subnational governments in Nigeria, public and private sector institutions across the globe, development partners, multilateral and bilateral donors to deliver on their organizational objectives and mandates. Now, our key areas of expertise include strategy design, product design development, capacity building, assessments, data management, and implementation and operational research. Just recently, in a bid to expand our knowledge frontiers and continue to contribute to learning globally, we created our research institute, the Sydani Institute for Research and Innovation, that is already making waves in the space of research and is the host organization of this webinar. And I want to use the opportunity to congratulate the SIRI team for this feat. Also want to acknowledge the leadership of the organization for the visionary commitment to development and to primary health care. Our work in immunization as an organization is encompassing. We've supported demand generation efforts working with the MPHCDA that saw over 7.5 million COVID-19 vaccinations in 12 months across multiple states. And in terms of strategy, we supported the government to develop the scale strategy that increased the uptake of vaccinations across the country and helping us to be able to achieve the target of vaccination as a country. We also supported system strengthening efforts for COVID-19 through one of our projects, a Gavi-funded management technical assistant project, working in 12 states, supporting thematic areas like financial management, vaccine and logistics, data management, advocacy, and social mobilization. And as a country, COVID-19 experience, tested our skills, tested our determination and expertise in being able to address proactively public health challenges. And we're also able to garner resources that, were deployed across the country. But as we transition to routinization and we continue to introduce other vaccines, it's also imperative that we are able to retrospectively gain from those lessons of COVID to improve the uptake of RI at the PHC's level. And that's what this webinar is about. I believe strongly that this discourse will do justice to the theme. And I want to encourage everyone here to take your notes, listen attentively, contribute to the discourse, and let's take these lessons and begin to implement at our various levels of influence. Once again, on behalf of the CEO, I welcome you all and great to have you all. Thank you.
Thank you so much, Mr. Andikan. Thank you so much for such a concise. It's probably going to be hard to talk about what Sydani is doing across the country and even outside the country. Thank you so much for that. And as he has said, please feel free to engage into this conversation and show your interest in developing the all the spheres of Nigeria that we are currently engaged in. Now we're moving on to introduce our keynote speaker. We have the pleasure to, in our midst, to have Professor Jonah Musa. So as you can see, Dr. Musa is a professor of obstetrics and gynecology at the University of Jos, Nigeria, and honorary chief consultant gynecologist at the affiliated Jos University Teaching Hospital, Jos, with over a decade of experience in cervical cancer research and clinical care in Nigeria. Prof. Jonah holds a faculty position as an adjunct professor in preventive medicine Cancer Epidemiology and Prevention at the Northwestern University, Chicago. Over the past decade, Dr. Musa has focused his clinical and research interest in gynecologic oncology and has promoted collaborative research in this area with collaborators from the Northwestern University, Chicago, United States of America. He is actively collaborating and participating in several ongoing extramural NIH-funded research, that's the National Institute of Health, and training projects in Nigeria with partner institutions at Northwestern University, University of Illinois at Chicago, Rush University, the University of Lagos, University of Ibadan, and USTTB Mali, West Africa. He is the principal investigator of a 5-year NIH Research Career Award titled Vagina Microbiome in Cervical Intraepithelial Neoplasia and Cancer, K43TW011416. Ladies and gentlemen, please welcome Professor Jonah Musa. You're welcome, sir.
Thank you very much, Ayetunji, for that kind introduction. It's my pleasure to join you today to share my views as a keynote speaker or on this very important public health event. Can I share my screen? I have some few slides that will guide my 15 minutes conversation. Can you help me to share? Okay. Yeah. So, yeah, I guess you can all see my screen, right?
Yes. Yes.
Yes. Yeah. So, when I was asked by Dr. Bemishola, thank you, Dr. Bemishola, on behalf of Sydani Group to invite me to share, to give the keynote speech on this very important meeting. I try to look around, as you can see from my profile, I'm in the gyno-oncology space, and one of the areas that interface with what you are doing in terms of vaccination is the issue of human papilloma virus vaccination, which is HPV. But looking at it, whether in that aspect, whichever type of vaccination program we look at, it is true that vaccines save lives. And I decided that I'll focus my 15 minutes speech related to that particular area. So my objective in the next 10 minutes or so is to just highlight the significance of vaccination in general, and then bring some highlights of the lessons we have learned on the impact of COVID-19 vaccination on global deaths. And then the last thing is to end my speech with the need for societal action and important considerations as we aim to transition from such to sustainability of uptake of vaccination at the primary healthcare levels. So the first truth is that all vaccines preventable diseases provides us as an opportunity to achieve reduction in disease burden, elimination of such diseases, and in fact, possible eradication of such diseases at the population level. It is no doubt a cost-effective intervention because it saves money in future costs for treatment of such diseases. For example, there was a time we did some economic analysis, we look at modeling, and it was shown that for cervical cancer, if we immunize, if we invest $20 to give human papilloma virus, it will save you almost $20,000 US in the future in treating invasive cervical cancer. And in all the vaccine preventable diseases, including COVID, we know that if we avert mortality, is a very cost-effective intervention. So, and if you look at it, the last bullet there, it averts morbidity, needless hospitalizations, healthcare costs, mortality, and loss in productivity. So there are a lot of economic gains if we invest in sustaining vaccination programs and increasing coverage. So as I mentioned, the second point is to briefly highlight, not in details, just to highlight the impact of the COVID-19 vaccination on global deaths. So this is a study, a mathematical modeling study that was published in Lancet Infectious Disease last year, mainly looking at the impact, the scenario where vaccine coverage reaches the 20% target by COVAX or the 40% target by WHO, and the number of deaths that were averted if we achieve that particular target. And this data was extrapolated from the report for just 1 year. So from the official introduction of COVID vaccine, December 8th, 2020 to December 8th, 2021. So the key highlights here is, if you look at it worldwide, the COVID-19 vaccination coverage was around 38%, and it averted over 14.4 million deaths worldwide. The interesting thing, or the main point that I want us to see, is that in high-income countries, you can see they had a coverage and you can see the number of deaths averted, about 6.4 million, compared to low-income countries where coverage was around 4%. You can see the number of deaths averted was just barely above 20,000 deaths. So telling us that the more we invest in increasing coverage, the more the gains we are likely going to have in averting mortality and even saving cost for the country and even for our global community. Using excess mortality again shows us similar gains, much more higher gains. But excess mortality here, they use the metric of all-cause mortality. In the first one, they focus on direct causes of COVID-19 mortality. But when you look at the excess mortality, that is all-cause mortality, and if you look at it as a metric worldwide, the vaccination, COVID-19 vaccination saved about 19.8 million deaths globally. And if you look at it by regions, you also find out that those regions that cover more vaccination had the highest gains compared to other regions, including our country, Nigeria. So in the same mathematical modeling, if you look at it here, this is the graph of all-cause mortality. And if you fit the regression line here, it gives you the space between the red line here and the black line here, tells you the number of deaths, the proportion of deaths that were averted by the introduction of COVID vaccine within just 1 year of COVID vaccination. Again, telling us how effective or how impactful giving vaccination could be in reducing needless mortality in the population. So again, if you look at this graph, all right, the choropleth shows us the areas where we have high coverage of vaccination, and then you also see the number of deaths averted. If you look at Nigeria here, it's tending towards about 4 deaths per 10,000 people. But if you go to Canada, North America, Europe, they were able to avert up to 170 deaths per 10,000 people because of high vaccination coverage. So the take home here is that there's clear evidence that investment to improve vaccination coverage has profound effect on mortality and with great economic value to society. The last point I want to highlight in this short speech is the need for societal action, and also to highlight some important considerations. And the strategy by the Sydani groups and all the support they have put with the national primary healthcare development agencies and other development partners, we cannot advance without having some good understanding of how we can move from our search now to sustainability. So I have brought in a recent report, and thankfully this was done in Nigeria, Lagos State. So understanding the multiple factors in vaccine sustainability using the socio-ecological model, all right, in public health. If we are looking at models for healthcare intervention, one of the very important and effective model is the socio-ecological model. And these researchers look at all the factors using the SME model, and they came up with intrapersonal factors, interpersonal, institutional, community, and policy factors. And I will just tell us that we should, the citation is there. We can read this article. It was published last year, and it will give us a lot of sense about what we need to do at the that is individual level, interrelational, interpersonal level, the institutions, community, and policy level. So some of the key things they found that could improve vaccine sustainability include things like caregivers' welfare and their love for children. How do they love their children? It has impact. And then issue about waiting times. So if we have a system that shortens the waiting time in the facility, all right, and then we clarify misconception about immunization, and then increasing the individual knowledge about vaccines and immunization in general. Those are factors that we should understand, and we should develop interventions to address them if we want to attain this sustainability. And then at the interpersonal level, individual level relationships, all right, social networks, and then peer involvement. In that particular study, they found out that the influence of friends, mother-in-laws, their own mother, their own experience could greatly influence their perception about immunization, and it can encourage these caregivers to take their children for immunization so that they don't have missed visits. And then institutional factors, the issue of access, the attributes of the institution, comfort, facilities, incentives, and then healthcare workers, staff coverage, and their attitudes. For example, during COVID-19 vaccination, we had some healthcare providers who were actually discouraging people. No, look, don't take this vaccine. So when we begin to have those negative perceptions coming from healthcare providers, we are not likely going to achieve sustainability. And then at the community level, community outreaches, national immunization days, and trying to do some catch-up outreaches can greatly help. And then utilization of community resources. And then the last level is actually the policy one, free immunization services. For example, rotavirus vaccine is supposed to be free for every child, but participants who responded in this particular study showed that, well, they wrote it in their own immunization card, but it's not available in the facility, but they do have it in some private facilities, but at a cost. So these are issues that should be addressed at the policy level. Immunization services, steady supply of vaccine and device supply, and then provision of child immunization cards. Child immunization cards here have been shown to be very effective in ensuring that even if a child or the caregiver travels outside their primary residence, they can use the immunization card to access the next schedule of immunization wherever they travel to. So these are some strategies that are emerging from implementation science research that will help us to achieve sustainability in our promotion of vaccines nationally and even as, as a group. The final thing is I want to highlight some other important considerations in uptake and sustainability at all primary healthcare levels. The first thing, which is actually coming from the previous slide, is for us to understand implementation science. We have evidence that this works, this intervention works, but how can we bridge the gap between the evidence and getting it to the level of practice? In this case, how can we translate what we know to be very effective and is workable? How can we take it so that every primary healthcare center in Nigeria will have access to these vaccines and they will be able to sustain this vaccination ideals around the country? So implementation science is very important. And the last slide that we talked about, that's a product that came from implementation science research. So I'm happy that the Sydani Group is also launching a research institute, and one of the areas that will help achieve the agenda of the Sydani Group is in the area of implementation science. So knowing the contextual determinants of implementation and sustainability, looking at key facilitators, barriers, obstacles, and enablers, all of these will help us to reach that particular goal. I won't go into too much of this, but one key area is the issue of messaging, communication. If we don't prepare our message very well, it may not support vaccine decision-making at individual level, interpersonal level, institutional level, community level, and even policy level. You know, and I already talked about the role of health professionals. If health professionals have a negative perspective, is going to harm all of this. And then one area that we must take note of is the issue of the role of the traditional leaders and particularly religious leaders. Just think about in Nigeria, there are some church leaders in Nigeria, if they just come out today and endorse that, look, all my members, go and take COVID-19 vaccination, go and take polio vaccine, go and take HPV vaccine, I tell you that the impact it will make in the population is going to be very huge. So as we plan to do this, to achieve sustainability, these are important stakeholders that we can engage in our discourse. And then the issue of barrier safety concerns, all right? Even HPV now that the National Primary Healthcare Development Agency has announced that they will introduce, we are already seeing a lot of very ill-intentioned messages in the social media. People are trying to kill the whole initiative. So these are barriers. So we also have to start thinking about developing counter messaging that will address some of the concerns that social media is really propagating falsely. You know, so we need to look at that, and we can do that through implementation science research. You know, obstacles such as out of stock, the role of culture and beliefs, you know, and then enablers such as stable supply and access to recommended doses of vaccine. I just mentioned rotavirus as an example. It's there in the immunization cards, but if people go to a PSC, do they have it? But if we have all these vaccines stocked in these PSCs and people go there, they have them, it will strengthen their beliefs, their confidence that anytime they go, they will have it. And that will really foster a culture of sustainability for vaccination. So I don't think I have gone beyond 15 minutes, but these are the few thoughts I thought I should share with us as a keynote speaker in this very important public health event. Thank you very much. And I'm happy to take comments, questions, and contributions. Bye.
Thank you very much, Professor Musa. We appreciate your time. You have said a lot regarding the factors that are, important when planning implementation, research, and intervention delivery, as we do at Sydani. I believe people have a lot of burning questions. I see a question already in the chat. We will be taking all the questions together for all the sessions at the end. Please, if you can type all the questions you have in the chat, or if you would rather like to speak when that time comes, we would open the floor for questions at that time. Thank you very much. We're going to be going to the next item on the agenda. If the team can please share the screen, that would be nice. We're going to Sydani's project presentation. And I'd like to introduce the team members who will be presenting that. Prof, can you please stop sharing your screen for a moment? Thank you. Yes, next slide, please. Yes, so for Sydani's project presentation, we have the pleasure to introduce Mr. Kolade Jimal, who is an engagement manager at Sydani Group, and Dr. Obiamaka Ewenzo, who is a senior associate at Sydani Group. They will be presenting Sydani's project. Next slide, please. Yes, I hand over to Mr. Kolade Jimal.
All right, thank you very much. Thank you so much, Professor Jonah. It's really great to have you dissect issues and speak to, some of the gains that we've been able to achieve from the COVID vaccination and how we can as well sustain these gains. In moving forward, we'll be speaking some of the work we've done as an organization. And to start with, we're supposed to also speak to what we do and who we are, Sydani. My colleague, Andy Caniban, had spoken so well about Sydani and what we do. So I'll not just so much on some of this. I'll probably just try to touch on some of the work we've done so that it also kind of like provides some background to how we've been able to collaborate with governments towards achieving some of the feats we've been able to achieve during the COVID vaccination. And now moving the conversation further to speaking about how do we sustain the gains, how do we achieve beyond the things we've achieved, and how do we transition from surge to sustainability. So if we could move the slide if we could move it to the next few slides so that I'll just touch on some of the work we've done. Okay, thank you very much. So Sydani, as a management consulting firm, we pride ourselves in our ability to deliver value consistently. And that is something that we've been able to achieve based on the trust we've been able to get from our clients and also from the government. And in terms of some of the work we've done, we've been able to lead several assessments that have been conducted working with government and partner. A part of it is assessment we did on the national, the Empower program, youth development and productivity, where we try to look at how these has contributed to, improvements in people's lives. And a similar one is the one where we had to work with Global Fund to conduct an assessment. We also did some assessments on COVID-19 health financing in the country, and we're privileged to lead the nationwide vaccine mock audit that was conducted working with the National Primary Care Development Agency. In similar vein, we've been able to lead lots of capacity building initiatives, strengthening the capacity of both government and partners in the country. We've done this working hand in hand with the National Health Insurance Agency and the National Primary Care Development Agency through the Basic Healthcare Provision Fund. And we've also worked with the Federal Ministry of Health in conducting capacity building on health project performance monitoring. We've done some work also on commodity supply chain management. One of it is our work working with the National Logistics Working Group on the cold chain equipment optimization. Next slide. I think I promised not to dwell so much on this, so just try to touch on the very fundamental part. So we've also done lots of work on data management, which of course many of these experience was evident in how we're able to drive the COVID-19 vaccination support during the surge. Developing models, developing approaches for data collection, and also effective data tracking. So we've also led lots of initiatives around demand generation, where we led a study on vaccine hesitancy in the country to understand the key drivers and barriers to COVID-19 vaccine uptake. And we have also supported leading initiatives on sexual reproductive health, a study on that. And as I mentioned, that we've supported lots of modeling development of models, which we did for the polio resource, for the transition of polio resources from partners to the government, amongst other ones that we've done. Next slide, please. Okay, so this is, okay, we can just move on to the next slide, just so we're able to manage time as much as we can. So we have our footprint in many countries within several regions. So we've done some work in Africa, Asia, Europe, and also North America. And many of the projects, some of the projects that I mentioned are projects that we've had to implement across all of these regions. So, and we are excited about other opportunities that exist for us to expand this support beyond the areas where we've worked. And we are happy to lend our voice to this conversation around how we are able to make indelible impact around the world. So thank you very much. So I'll be facilitating this session together with my colleague, Dr. Biamaka. But before she comes in, I'll just provide some background to some of the work we've done. Yeah, so you can move on to the next slide. Yeah, please go ahead. Okay, so, sorry, a slide, go back to the previous slide. Okay, so in terms of how we'll be speaking to the work we've done and the lessons we'll be sharing, we'll be looking at how our thoughts around how we can transition from surge to sustainability, and what we are thinking about how we can adopt the learnings, the lessons learned from the COVID-19 vaccination approaches to scale the routine immunization uptake in the country. Beyond that, there are a lot of new vaccines that have been introduced. There's the HPV vaccine that's currently being introduced. So the question is, how do we transition from surge to a system where we're able to sustain all of the things we've done? And we are not just being reactive, but we are being very proactive. So that's what we'll be speaking to largely, myself and my colleague, Dr. Biamaka. Next slide, please. Okay, so as we are aware that when the COVID-19 pandemic, when there was the whole outbreak of COVID-19 pandemic, there was a lot and lots of challenge for the country, not just Nigeria, but at the global level. And during this period, while the country made lots of effort to ensure that, other health services were not affected, we still had around 43% of children that were not vaccinated, as reported by the multiple indicator cluster survey of 2021. While the country was able to transition from 33% in 2017 to 57% in 2021, we still had 43% of children that were not vaccinated. That means we have children that were not protected. And with all of the investment and resources that we've put into vaccination, this is something this is something that is a global concern. And what we're looking at is how we are able to look at the achievement we've been able to record by supporting initiatives around COVID-19 vaccination and routine immunization through funding from donor agencies and collaboration with government, to see how we can use this learning to, sustain the gains of vaccination in the country and further strengthen the primary care services and routine immunization in the country. And that's what we'll be discussing today. But as we do that, we'll also be providing some context, some of the work we've done within the country before we then deep dive into how we feel we might be able to, scale up all of these initiatives and achievements in Nigeria and beyond. So I'll be handing over at this point to my colleague, Dr. Biamaka, who will be speaking to some of our work in the country. Yeah, Biamaka, over to you, please.
Thank you very much, Akolade. Good afternoon, good morning, everyone, and thank you for joining. So I'll be speaking to some of our work that we've done and how we are thinking of the best way for the transitioning to occur using this outline. So first, for the generation of the surge, it's important to note that Sydani implemented surge activities across 18 states, 18 of the 37 states in Nigeria, with funding from donors such as USAID, USCDC, and Gavi. It's also important to note that across these 18 states, that our scope of support ranged from service delivery, demand generation, capacity building, and technical assistance. So please, can we go to the next slide? Thank you. So for the implementation of the strategy, we reviewed the WHO health building blocks, the real micro plan, which is reaching every ward plan, and then the skills strategy. Skills strategy stands for service delivery, communication, accountability, logistics, EMID, and supportive supervision. And it's important to note that the skills strategy is the official strategy for the Nigerian government for COVID-19 vaccination. And with the review of these 3 strategies, we were able to adapt this 6-step strategy. Now, I'll be speaking more to the skills strategy, and that's because for the implementation of the COVID-19 surge in the country, we basically implemented this skills strategy. Now, for service delivery, for the development of our vaccination plans, we utilized the geographic information system mapping, the NDVP, and then state microplans, which aided us to develop our site selection. Also, we were able to recruit, train, and deploy over 600 vaccination teams. It's important to note that about 250 of these vaccination teams were completely mobile vaccination teams, which ensured us to visit really hard to reach settlements, border settlements, and really inaccessible settlements. Also, for service delivery, we employed a performance-based payment structure to ensure that our vaccination teams were kept motivated at all times. For communication, we collaborated with demand generation implementing partners across our states of implementation to ensure that we reach our target audience. Accountability, we supported and were part of the daily review meetings that were conducted at the subnational levels. Through these meetings, we were able to identify teams and settlements or areas where vaccination uptake was really poor. And through these meetings and identification of these areas, we were able to deploy strategies to address the site-specific issues that came up. For logistics, we routinely monitored the vaccine utilization and stock balances of the state and local governments that we implemented in. And through this, we were able to ensure that there was little or no records of stockouts for the COVID-19 vaccines within these locations. For the EMID, which stands for Electronic Management and Information Data System, which is the electronic system that the national implemented for the real-time data monitoring of the COVID-19 vaccination, we were able to have engagements with meetings with the National Primary Healthcare Development Agency. One of the important things from this meeting is that we're able to obtain individual EMID codes for our vaccination teams, which ensured real-time visibility of what our teams were doing at the national level. And we also provided support to our teams to troubleshoot whatever faults they had with the EMID login details. It's important that I add at this point that in addition to the EMID codes that were obtained and shared with our vaccination teams. Internally at Sydani Group, we also had a data control room where we monitored our vaccination teams on a daily basis, and the data obtained was what we used to ensure supportive and targeted supportive supervision to the teams to improve their capacity and ensure that they were working optimally. And then finally, for the supportive supervision, in addition to providing supervision from the state from multiple levels, we also engaged independent supervisors to have an independent view of what our teams were doing, which was very helpful. And through the implementation of this scale strategy, please, if you could go to the next slide. Through the implementation of this strategy, these are the results that we obtained. It's important that I note that a majority of the results that you'll be seeing here are the results from the Sydani IHP COVID-19 surge, which we conducted in 2 phases. The first phase was between July to December 2022, and the second, February to April 2023. From implementation of this support, we were able to, our percentage contribution to the total state vaccination ranged from 22% in Kebbi State to about 85% in Ebonyi State. And from February to April, our percentage contribution ranged from 60% in Sokoto State to 98% in FCT. So across the different states and in conjunction with our funders, we're able to significantly contribute to the state's vaccination numbers for COVID-19. Please, could you go to the next slide? All right. So for Ekiti State, which was funded by the US CDC, we were able to meet the targets that was given to us by our funders and exceed such targets by 78%. It's important to note that across all our implementing states, we were able to improve their national standing from COVID-19 vaccination, with 3 states worthy of mention, Kebbi, Sokoto, and Ekiti, which were able to move to the first 15 states in the country. Next slide, please. All right, so in sustaining our results, following the success of the COVID-19 vaccination across all the aforementioned states, we felt it was important to actually document the lessons learned to bolster the routine immunization, as we saw that some of these lessons could be implemented, some of these strategies could be implemented in routine immunization. And due to this, as a result of this story, we were able to come up with the C4 sustainable framework, which we adapted. Now, for this 4-pronged framework, the first is the commitment. So for commitment, we saw that commitment from the leadership at the various levels ensured that this project was, ensured that we were able to meet our targets for the project. Integration of strategies also into existing policies was very helpful, and then the allocation of necessary resources would help to sustain vaccine uptake exercises. For competence, one thing that came out clearly is that capacity building was very important, and then continuous development of healthcare workers to not just know how to conduct activities, but know the reasons behind the activities and the implications of non-conduct of these activities would further improve routine immunization uptake in the country. Also, the training of the cold chain officers on vaccine forecast and quantification would help minimize vaccine stockouts across the lower levels, which is the local government area levels. For communication, maintaining open and transparent communications with the relevant stakeholders, regular conduct of advocacy, communication, and social mobilization activities to ensure the public is well aware and informed of vaccination activities, and not just waiting for only when interventions are to be conducted for these ACSM activities to be deployed. And next is establish mechanisms for feedback, which is something that I would say was really helpful for the success of the COVID-19 ramp-up projects. And finally, continuity. So integration of mobile vaccination teams into the primary healthcare system, because many a time we see that a lot of teams are trained, a lot of resources has been poured into, building people's capacity. However, the continuity, integrating those individuals into the system so that there is just a continuity of what has happened, that rarely occurs. And that was why this was one of our recommendations. Next is implementing a robust monitoring and evaluation system across different levels. It would help to assess the impact of the intervention and then identify the gaps. And then finally, which is a very important part of every strategy or project implementation, flexibility. So flexibility in strategies so that these strategies can be changed based on peculiarity of location or state or whatnot. Next slide, please. Now, with the lessons that we learned from the C4, we utilized this sustainable framework, and with the support of our funders, we were able to implement a routine immunization surge across 6 states: Bauchi, Ebonyi, FCT, Kebbi, Sokoto, and Ekiti. And we can clearly see that the targets given was way exceeded. And that's because we moved these C4 strategies into routine immunization. And you can see that there was a massive increase in routine immunization vaccinations across all the states. Next slide, please. Now, challenges and implications for stakeholders. Now, some of the challenges that we were faced with during implementation of the C4 sustainability framework include first, data management. So inability to submit reports due to epileptic network, the fact that a lot of data discrepancies across the different reporting systems, the fact that some of the data tools that are still in use currently are still paper tools, and there is need for movement or a transition from paper tools to electronic tools were some of the challenges as regards data management. For leadership and coordination, one thing that came up strongly was competing priorities, as we had several times we had to reschedule certain meetings because of unavailability of the state stakeholders due to other engagements. And then communication gaps hindering effective collaboration among stakeholders was a challenge. For supply chain and logistics, interruption of vaccination activities due to unavailability or stock out of essential commodities. I know there was a time for COVID-19 vaccines where there was a countrywide stock out of barcodes in Bauchi State, and that greatly slowed down our vaccination activities in the state. Supervision, inaccurate use of the identified data collection tool, which for the COVID-19 ramp-up was Kobo Collect by the state and LGA supervisors. So with that, some of the reports shared were not as rich as we had planned for it to be. And then finally, financial management, which include budget constraints to accommodate allocation of allowances, and then delay in remuneration of teams due to bureaucratic bottlenecks. So across these stakeholders, we've identified the implications of the challenges. First is for the government, we advise that there should be creation of an environment conducive for effective collaboration and coordination, and ensure that communication of strategies, plans, advocacy of vaccinations, and the importance of these vaccinations are cascaded downwards in a very clear manner. And also for the prioritization and allocation of resources equitably for successful implementation. Next is for the donor agencies. We highlighted that the need for provision of financial resources for projects covering expenses for various activities, participation in monitoring and evaluation, because it's important when the donor agencies are part of these M&E activities to ensure alignment with the goals of the project. and then finally contribute to valuable strategic guidance based on their knowledge and experience. For the implementing partners, we advise collaboration with the local communities to address skills gap, tailor strategies and effectiveness, actively participate in coordination efforts and share best practices. So, and finally, seek diversified funding, advocate for transparency and collaborate on joint proposals. For the community, there is need for active participation in community stake engagement and information from and seeking information from reliable sources. This particular recommendation came as a result of a lot of times there were a lot of misinformation and disinformation spanning from the community levels, which hampered the seamless implementation of some of the activities, and then take the initiative to educate themselves about importance of vaccination. So thank you very much. Iyanu, over to you.
Thank you, Akolade and Obiamaka, for such a wonderful presentation. I see a lot of questions on the chat and a lot of comments for the both of you. Again, we will take the questions at the end of all of the sessions. So please stay with us and keep noting your questions if you want to write them down or down there in the chat. So now we're moving on to our panel discussion session. I'm going to introduce again Mr. Akolade Jimoh, who is going to be the moderator for this panel discussion. Over to you, Akolade.
Thank you very much, Yano. Thank you, Dr. Obiamaka. Thank you, everyone, for staying tuned to the call. Quite a lot of insights have been coming up, as regards how we can sustain the gain and move from such to sustainability. And I'm privileged to have our seasoned speakers, how we can further achieve this sustainability beyond and move things beyond the soil. So I have here with me today Dr. Gebi Usman, who is from IHP Nigeria. I have Dr. Adejoke Kolawole. Dr. Adejoke works at the National Primary Care Development Agency. We call her the Grand Commander for the COVID-19 control room. And we have Dr. Gilbert Ayodele Zelua, I believe is represented by the State Immunization Officer. And then we have our own Hajia Kubura Daradara. She's a senior strategist at Sydani Group here. They will be part of the panel. Please confirm if you can hear me, my able panelists, as we proceed with the conversation.
We can hear you.
Hi. We can hear you. I can hear you.
Okay.
We can hear you.
All right. Thank you very much. Yes. So to start with, a lot has been said as regards the whole COVID-19 vaccination, the strategies that have been implemented, the success we've achieved. Of course, now we'll be speaking from the lens of Sydani. We want to really get your opinion and views about this. And I'll start with you, Dr. Adejoke, as a representative from government and someone that was really instrumental towards many of the achievements we've had. WHO has said that Nigeria, if not the best, probably the best country that performed well when it comes to immunization, COVID-19 vaccination within the space, in terms of all of the strategies we've implemented, in terms of the numbers we've been able to achieve, in terms of how flexible we're able to change things. So for me, I would like to ask you, how does that feel as a government representative? What do you think about that? Given that we've been applauded for the performance we've recorded. What do you think, Dr. Adejoke? I would like to get your opinion about this. Over.
Okay, thank you very much, Mr. Akolade. I also want to appreciate the Sydani Group for having us on this platform. Nigeria as a country, we are very happy about that. It's always encouraging to receive reviews and good reviews for that matter, and particularly when it's from internationally recognized bodies, how we have performed. So we are happy about that. And I think it has also spurred us also to continue to do our best to ensure that we reach our target population as much as possible, everybody with the COVID-19 vaccines. And we have not done it alone. Your team was part of the COVAX strategy group, COVID-19 vaccination strategy group, which is the collaboration of both government and partners, where we come together, deliberate, and work together to devise strategies on how we'll get these vaccines into the arms of people, of the eligible persons. So it's a good feeling, and we are glad to have reached our 70% target population coverage, but we are still continuing our vaccination and already routinizing the COVID-19 vaccines into the routine immunization system. Thank you very much.
Thank you very much, Dr. Aditoke. Yeah, definitely it's a good feeling. Yeah, and of course, when Nigeria has been mentioned to not be doing so well in some areas, when we hear the good news about some of the things we're doing, it gives us that reassurance that things can always be better. So thank you very much. So I'll move over to Ajia now. Ajia, you're someone that's worked in both the government and now you're a partner, and then you've led lots of initiatives towards what we've achieved. From the IHP support, you've been very instrumental towards driving many processes and results. What do you think, in your own opinion, what are the things you feel contributed to these achievements? What would you say are the things that contributed to the achievements in your own perspective? Ajada, over to you, ma'am.
She's muted. She's muted. She needs to unmute herself.
Okay, Ajia.
Okay, sorry,
okay.
I have unmuted.
Oh, okay, great.
So thank you very much. If I mute myself out.
Okay, we are with
Thank you very much, Mr. Yes, I think I'm working. And thank you very much, Mr. Kolade, for the question. So I think one of the key factors why we're able to succeed was because of the proper planning. There was proper planning at the national level, and then there was also partner coordination. Dr. Adejoke has referred to the COVAX strategy group. So this was a group that was meeting on a daily basis to plan priorities for the campaign. And then there was always constant monitoring of the coverage. There was constant monitoring of the coverage. We're always monitoring the exercise. And then also the scale strategy. So the scale strategy was one that was properly implemented by Sydani for the IHP project, which was a performance-based payment. We were very serious about the accountability part of it. It was performance-based payment. And that was what actually motivated the teams to go out and do the vaccination. And here we're monitoring the number vaccinated, because every time we look at approximately how long does it take to vaccinate an individual. We did this in order to curb the issue of data falsification. So I think proper planning and the performance-based payment was what actually counted for the success that we had. And there was also a lot of community engagement efforts. Thank you.
Thank you very much, Ajay. Thank you very much. That's very insightful. And honestly, I for one, I think at different instances, I've been at gatherings where Nigeria has been applauded for the scale strategy. I know it was a lot of transition for the country. There are lots of initiatives. We even had scales 1, 2, and then before we even moved to scales 3. So, Dr. Osman, I would like to get your perspective as a partner representative. What do you think, from your own point of view, contributed to these achievements? I would like to get your thoughts on these.
Well, thank you very much for the opportunity given to me by Sydani to participate in this very noble discussion. I think for me, as a representative of partners that has been involved in this, it's the country having one common strategy and one implementation plan. And most importantly, every stakeholder kind of bought into that because it was kind of jointly developed. And most importantly, resource was managed in as much as possible a relatively transparent manner compared to what we're used to. And most importantly, it's like Daradara has said, it's a performance-based payment. Now, one of the lessons that we have learned is the strategic team that the country brought together that to me allowed people to kind of be available, nothing like holiday until the objectives are fully met, and reviewing and kind of almost readapting the activity at every point based on real data that is coming was a real change maker for the whole implementation. Leadership, leadership at various levels. Leadership at the national level, it's not a leadership by delegation, it's leadership by being present. It's like a significant sacrifice and flexibility even on the part of funders, because it's like at a point, because we're seeing results, it was easy for us to kind of modify some of the bureaucracies that we see even in moving resources to support whatever could be strategy we are kind of implementing. And we have realized that sometimes it's like no matter how good a team you have, you can only manage what you can count. And because we were every day looking at the numbers and focusing on those that are the slow performers and asking ourselves why, and everybody was there, was actually the appropriate treatment to bring intervention almost immediately. Now, of course, there were a little bit of some challenges due to a little bit of hiccups. It was not it didn't surprise anyone. And again, the immediate flexibility of the national team to quickly adapt, and thus the change from scales 1.0, 2.0 to 3.0 to bring all the issues concurrently. It's like there's no separation of some of the elements of the strategy from the big picture, so that each one is planning within the same space. And that was duplicated at state level and at local level. And to me, this is really something that we should celebrate. And for me, it also, despite working with the partners, it shows us a Nigeria that works. And the potential of what we could do if we all focus on one common agenda and everybody brings his own 1 cent to support that particular national strategy. In terms of transition of this kind of strategy to routine immunization, again, that flexibility has to be learned beyond partners, government, state governments, and local government. And I think this is a real learning that we must share, and people must understand it, because it brings success. And as they say, success has many fathers. But most importantly, I think the key performance at the national level, government itself really played the most important critical role, because without that openness, that transparency, that shared communication and trust, it's like all these, no matter the skill sets that people have, would not have been possible for us to adapt. So I think trust, complete, transparent communication is a key thing that we can bring to bear in routine immunization. And to me, I actually prefer to even widen it to go to what I call data that determines how we react. It shouldn't be just because there are 10 things that we must do in policy that you must pursue all of them with the same vigor. The data should be able to lead you where you should be able to play emphasis. And then it's like you should be flexible, that you can kind of review what is on the ground and put your money where you're best going to receive the best results. And I'm pretty happy with what Prof shared, because it's kind of an umbrella cover of almost the whole thing. And the Skills 3.0, which government and all of us kind of implemented, was the implementation of how that works. And I think what we are doing now, sharing those lessons, and most importantly, to publish it, it's like it's almost like a historical kind of finding. Yes, it's not really have enough rigor, but I think this needs to be published to share the whole national experience for all of us to learn, and for other countries to learn from us, because all these things are possible. And if we put that unit to the whole primary healthcare structure, we can honestly achieve what we want to achieve, because nothing is free. It can be available, so-called it's free. But I think even the communication learning from COVID, we need to kind of change it, because somebody somewhere is putting money. And sometimes the choice of words may bring the wrong notion, and we may have to think. And I think the communication team being available to contribute to the discussion so that people can understand complex things within very simple language is key. And I think this coordination and collaboration all are key. But to me, the national buy-in and the leadership that has played was that thing that made a difference.
Yeah.
Over.
Thank you very much. Thank you very much. There was lots of insights there. One thing that came out for me, I mean, I don't know, but I like that word where you said data that determines how we act. I think I really like that. Being able to act based on findings, right? I mean, that's good to know that that's part of the things that was able to help us achieve the things we're able to achieve. I'll be moving very quickly to Dr. Ms. Ajimati, who is the State Immunization Officer from Ekiti State. It is one of the states where Sydani implemented the COVID-19 and RI projects with funding from CDC. So, Ms. Ajimati, hello, ma, can you hear me?
Yes, I can hear you very well.
Thank you very much.
I can hear you clearly.
Yes. So Ekiti is one of the states that is topping the charts, and Ekiti has done that consistently. We are happy to be part of that success story in Ekiti State. And so it's a wonderful thing to know about how the state is driving initiatives to promote vaccination. One good thing I would like to say is, while we've been able to implement a lot of strategies in Ekiti State, we've been able to have a lot of achievements. How are we sustaining these achievements in the States? What are we doing to ensure that, this is not just something that happens at the immediate, and then going forward, we don't have this kind of system in place again? So what is the state doing to ensure that we're able to sustain this gain? And ensuring that now it goes beyond COVID, and it's also considered to RI and other new vaccines that are being introduced. So can you share your insight as regards this?
Yeah. Thank you so much. Let me say good afternoon to everybody on the call, and I thank you for giving me this opportunity to participate in the call. Now, let me first of all talk about how we have been able to achieve a lot in Ekiti State. I think I will first of all appreciate the National Primary Healthcare Development Agency, because they were all the while coming up with various strategies to ensure that everybody is vaccinated against the COVID-19. Yes, they were bringing out, and we will have scale 2.0, scale 3.0, and others, and so many strategies. And in Ekiti State, as they bring it, we were going with them. And in Ekiti State, I will also give kudos to the type of leadership we have in Ekiti State. When the COVID-19 infection came about in Ekiti State, you see every stakeholders, including the governor, the commissioner, everybody was all out to even prevent the spread of this disease using non-pharmaceutical methods. And it was this tempo that we in Ekiti State used when they eventually have the vaccines. And I want to say our success will be adduced to dedication and the supervision by the leadership. During the vaccination period, you will see our commissioner will be on seat every day for daily review meeting, just to ask us, where are we? What is our challenge? And any challenge raised will be addressed promptly. And that was why we were able to achieve so much in Ekiti State. And when the tempo was like going down, we have Sydani coming around. When we are in Ekiti State, what we need is just a little push, and our people are ready to work because we have dedicated workers in Ekiti State. Now, to the question of how we are going to sustain the tempo. Yes, like I have said, we have dedicated personnel in Ekiti State. And as I'm talking to you now, the vaccine has been on our RI schedule. It's been routinized in Ekiti State. And we continuously tell people to go to our health facility to have these vaccines. And we also leverage on any program, any health program, like any SIA, supplemental immunization activities. When our health workers are going out, they usually go out with COVID-19 and other vaccines. So by so doing, we are trying to keep the tempo and move on. Then any outreach, we go out with our vaccines. Even if it is maternal and child health week, any health program, we make sure that we go out with all our vaccines. So that is how we have been doing it in Ekiti State. Thank you, and over.
Thank you very much, Ms. Ajimati. That is really, really helpful. So what I hear now is there has been that deliberate effort to routinize both COVID and RI, and also integrate all of these at interventions so that whenever you're having another program, you can also adopt all of the learnings. I think I can attest to that, and kudos for that. It's really good to hear that. Dr. Adejoke, I would like to hear your perspective on this too, at the national level. How are we able to, transition from surge to sustainability across all of the things we've done? I, for one, I know there are lots of initiatives, lots of wonderful ideas are coming up. There's performance-based financing and all. How are we able to transition all of these gains, all of these initiatives to, other PAC services and also routine immunization? Over.
Okay, thank you once again, Mr. Kolade, and thank you for the opportunity. So most of what we gained in scales 3.0 are already been transitioned into routine immunization and the wider PAC system. And for example, everybody has mentioned the EMID. EMID stands for Electronic Management of Immunization Data. So it's a data repository platform which was created specifically for COVID-19, as in that's to get information. And that is how when Nigerians scan the barcode, or people that have received the vaccines in Nigeria scan the barcode on their vaccination card, they can see their data. So it gives us real-time access and real-time data from the field, and we're able to know. And then we transformed it during scale 3.0 to be able to also be a kind of accountability measure, where even the vaccination teams are captured on the EMID platform. So we can know who is which team is vaccinating, where they are vaccinating, and how many clients they have vaccinated during that period. So that is already being transitioned into routine immunization, so that at any time when any team goes out, they are registered on the platform, we can also view immunization data real time and know where challenges are, which outreaches are not being properly conducted, where they are not reaching, and quickly address the issue. So we want to continue that process, like how we use the data for action that people keep saying is how we're transitioning it. And it's already, that training has already taken place across the country in the states for the EMIT platform. So performance-based financing, we know we harmonized all payments across board. So whatever, which all the programs, these are the same amount that is received, and that is what goes across. So there is no disparity that this program is not paying as much as this. And I think that also helped to know that, okay, the program was not left, and it's also what is being transitioned into other programs. So there's a particular amount that is being paid to health workers or to ad hoc staff when they participate in programs. So, and it's based on how much you work. So if you, there's a percentage for if you achieve your target for that day, if it's only 50% you achieve. And I think that's also moving that into all health campaigns and other primary healthcare programs will also help us to achieve, continue achieving our results. So the integration also, Nigeria was one of also those countries that quickly integrated services from the beginning. Since 2021, since our second phase of implementation of the COVID-19 vaccines, we had integrated our services. So we had blood pressure checks, we had blood sugar screening, and all those other measures. So we wanted, as soon as you get to the primary healthcare facility, it's not just about the vaccination, but there's other aspects of your health, nutritional screening, all those things were part of Nigeria's plan. So we had integrated services, and we're continuing that, and that really helped us, because it's the same health workers we meet at the primary healthcare level at the facilities, are the same health workers that will go for outreach. So once they go for outreaches or at the health facility, they provide all services so that every Nigerian or every client that they meet gets a holistic health service. And that is something that we are moving forward. And it's even one of the drives that the current administration is also pushing forward, integration of services. You should be able to, wherever you reach a health worker, you should be one-stop shop for everything you want to get without having to necessarily keep going around and wasting time. And that also helps the country and the health system to improve and get better. So I think it's one of those things. And I think also continuous mobilization, demand generation, creation of awareness about vaccines, about PHC, as we should, like I said, with the integration, that awareness should continue. And also managing of rumors, quickly addressing rumors so that it doesn't affect our services that we are providing as a country for the health of our people. Thank you very much.
Yeah, thank you very much, Dr. Adejoke. That's very helpful. I helped lots of things around, how we're able to transition the PBF, performance-based finance of payment, now to other areas, like other primary care services. I like to call it "Earn as you work," if there's any word like that, right? So it's good to know that is something that we're considering, and also the whole integration. Interestingly, Nigeria is taking the lead on that, and we look forward to the wonderful result that will come out of that. Moving forward, I'll be moving over to Ajia now. So Ajia, for the COVID-19 vaccination support that was provided, I know at this time there were lots of challenges. Of course, I'm sure it wasn't just a smooth ride. So what do you think, how can we apply all of the experiences that we've been able to gather in COVID-19 vaccination to routine immunization and other services? There is the whole new vaccines that are being introduced in Nigeria. How do we apply all of these lessons to routine immunization and other PHC services? How do you think we can apply all of the experiences we've gathered so far? Over to you.
Thank you very much. Who else is? Have you muted? Okay. So thank you very much, Mr. Kolade. So I think the first experience that we have gathered on this COVID-19, during the COVID-19 vaccination is the issue of everybody working together with government. So for the COVID-19 vaccination, all partners came and worked together with the government to achieve the results. And thus were able to mobilize resources. I think that would be very helpful for routine immunization. So we found that sometimes some partners are doing routine immunization or they are doing their own thing that government is not aware of or government does not approve. So I think the issue of all partners coming together as one for the success of the routine immunization will be very important. And then number two is the issue of community engagement. So we found during the routine immunization that continuous engagement of the community was very important. So even communities that had earlier refused to accept the vaccination, with continuous engagement, they were collecting the vaccination. You go, they refuse, somebody goes again, and then you find that later they collect that jab from you. So the issue of continuous engagement is very, very important. That is what will make people know the importance of routine immunization. As it is now, people don't really understand why they should get their children vaccinated. So that enlightenment is very, very important. And for COVID-19 vaccination, from the get-go, we involved the traditional and religious leaders. And that would also be very important for RI. Involvement of traditional and religious leaders in the vaccination of the children in their community. Let them take charge so that it is the traditional and religious leaders that are telling the parents and the caregivers, go and get your child vaccinated, and asking the caregivers, which vaccines have your children got, so that they can know the vaccines that they did not get. I think that was one of the things that we really learned in the COVID-19 vaccination. And then also the issue of the EMID. Dr. Adejoke has referred to the RI EMID that is now being, I think the training is ongoing in some of the states. So part of the success of the COVID-19 vaccination was the fact that we could see real-time data. So at any time, we were looking at the data and we knew those that we know areas that had good coverage, we know areas that would not have good coverage. So it is very, very important for governments to make sure that this EMID succeeds. So that even the healthcare, not only for outreaches, even the healthcare worker at the health facility, sitting there doing his vaccination, should be entering in the data real time, so that it can be seen everywhere that yes, this child has gotten this vaccine and is due for this vaccine on which dates. The issue of resources, I think I have spoken about. Resources are very, very important because for COVID-19 vaccination, we had enough resources to do outreaches. The teams had money for mobilizing them. The teams had money to mobilize them to the communities. For RI, it is not like that. Whenever you ask a team about any health facility, why they are not doing outreaches, they will tell you that they don't have resources to move out. So there were lots of lessons that we learned from the COVID-19 vaccination, which if taken into RI, will really get us the results, especially now that COVID-19 is being routinized. So before the teams were going out with the COVID-19 vaccines and also the RI vaccines. But now the national is planning to routinize the COVID-19 vaccination. So we really, really need resources. And then we need the partners to work together. We need everybody to be on board, the religious leaders, the traditional leaders, and we need real-time data reporting so that action can be taken where necessary. Thank you very much. Over.
Thank you very much, Ajia. Thank you very much. So while Ajia was answering that question, she emphasized so much on collaboration, the need for government partners and everybody to come together. There's a part of also ensuring that we work towards having enough resources, mobilized resources, and also engaging critical stakeholders to have good alignment. One quick question to Dr. Osman as we wrap up the conversation. So I would like to ask that in terms of the funding strategies, was there anything for COVID-19? Was there anything that was any strategy that made a definitive difference in terms of the things we did, the support we provided for COVID-19 as a partner? And how do we plan to transition such to RI and other PC services? What did we do differently? Was there anything we did in terms of how we funded activities, and how do we want to transition that to other, were there learnings on how we could transition that to other PC services? Over to you, sir.
Yeah, well, thank you very much. Now, for me, it's like what we all succeeded in doing and what brought the difference was the additional resources that were given. But those resources that were brought were not just in terms of financial. Now, it's like having one team and managing that system as one coherent team is one of the most important elements. Yes, of course, there was money that came from various ports, from the UN system, from Gavi, from the African CDC, from many other stakeholders, and of course, the Nigerian government. But how do we transition this onto our everyday thing so that we stop reacting as with this kind of a knee-jerk response, waiting for the next epidemic or waiting for the next emergency? To me, it's like we already have a system that we have proven can work. And starting from the primary healthcare in terms of policy, what allowed all this to work is one policy that kind of we have made to work at different levels, but we may not be seeing it. The primary healthcare under one roof policy, because it is the work of that at the state level down to the local government and facility that has allowed, even when you have the resource, to know exactly where to flow it through. So that is important. And to me, I'm looking at how do we sustain this to make sure that whatever it is that comes, it is sustained. One thing is, of course, once we are past the emergency, is to routinize all these things in terms of policy. But how do you fund it? Now, to me, the direction that government has taken towards universal health coverage is the key, because nothing is really free. And I'm happy with particularly the 4-point agenda that the government of Nigeria has shared at the council meeting. And to me, it provides a vehicle for continuity. How do we ensure that it is not just a partner thing, it is not just a federal government thing, that the states put their own resources where evidence shows? What Prof talked about, there are various lessons and data that's available that has shown where do you best invest your money that gives you the maximum impact and things for your buck. Now, the insurance mechanism is honestly the best key towards universal health coverage, and that has been proven, and there's just no point trying to do it. And I think they say there's no wrong step in the right direction. What we're doing, particularly with regards the basic healthcare provision fund and the state health insurance scheme that have been all kind of started and are working, should be strengthened. And how do we do that? I'm bold to say that not much has happened in terms of states contributing resources to ensure that it goes in routinely without each state or each small unit kind of flexing and a lot of things. And once this is put with one key unified plan, health plan that is based on evidence that can be generated and then shared, and then it is being managed together as a team from the federal down to state level, down to local government and facility and communities, all we've talked about. That is what will sustain sustainability, so that routine immunization, RMNCH activities, most importantly, something like even family planning, which is another very important intervention that brings maximum gains, as Prof has mentioned, to the communities and of course the country. But one last thing is that most of the challenges we're having in terms of local funding sustainability is that the controllers of the purse ask you, well, I've put in this much money, what did I get out of it? So we need to kind of look at the lessons we've learned to translate how do we show that for the leaders at various levels and government, for the politicians that are ultimately the executive that really bring this money in budget and so on, show them that for these millions that you put, this is the gain and it is proven by numbers. And therefore, the Ministry of Budget, in terms of allocation for sustaining PHs for absolutely essential services that bring results, immunization, family planning, RMN, CH, other preventable diseases by vaccination, and so on. That is the only way that we can achieve what I call independence and then ultimately sustainability. And then we can continue to collaborate to make sure this works. So we are on the right track, but it's like it shouldn't, our feet shouldn't be taken off the pedal of this movement of the policies that were on PHC to move on and to put all this into one funnel that will make sure this thing continues. So to me, that's the best way to move forward to ensure that this is sustained. Over.
Yeah, thank you very much, Dr. Osman. Lots of insights to take from there. Our time is fast spent. So I mean, there's other things I would love to ask, but our time is fast spent. So I will just ask Dr. Adejoke to wrap up very quickly. So Dr. Adejoke, so sorry, in like 2 minutes, I would like to request that in terms of how we move forward from here, in terms of how we are able to, the steps we're able to take, what are the things you feel government partners and other relevant stakeholders need to do to jointly collaborate? Because that's one thing I've heard today, to jointly collaborate towards sustaining the gains of COVID-19 vaccination. I mean, the strategies implemented for COVID-19 vaccination. I'd really like to get that last few thoughts from you.
Okay, thank you very much once again. And I think Hajadara Dara, Dr. Gebi have actually really touched on it. And that collaboration was the leadership and the political will that was committed into driving COVID-19 vaccination. So we had this slogan, one country, one plan, one team, one budget. And that translated into us doing a resource mapping. So it was not just about financial, and it was also about all types of resource, whether human. So everybody came together and it was one bucket. Let us put it that way. And that was assigned according to, okay, what this can cover this, that can cover that. And then where is the best place your own, what you are bringing to the table can go to. So that collaboration, I think, needs to be sustained across all levels and not just at the national. I think the states, LGA should also adopt that. Whatever partners or whatever resources or structures they have, there should be that one team, one planning, one budget, one collaboration planning. That should, I think, if it's sustained, that will always ensure that there are resources available and plans are properly harmonized, and that will even reduce fragmentation of programs across the country and within the states in particular. And then I also want to emphasize on community engagement, like Haja Dara did. That was really a key, as in once the community is aware and they're properly educated, they will drive the process themselves. So what we need to do is to continue to build on our interpersonal communication skills for our health workers and across town announcers, across our local communities, LGA, ward level, as we properly educate them on what immunization is, what primary health care is, or what the government has for them, and how partners are collaborating, so there's no hidden agenda. We all come, we're like, say, if it's one team, that will come one message, and this is what we need to do. So I think that is what I will say should continue going forward and should be strengthened across all levels. Thank you very much.
Thank you very much. Thank you very much, Dr. Jackie, and thank you very much, everyone. So one plan, one team, one budget, and one project, right? So thank you very much. We believe that with that, with the right kind of commitment, we'll be able to transition from soil to sustainability. So I want to really appreciate everyone for that wonderful insight, for taking time to contribute to this. I think I'm like 9 minutes above the time that was allotted for this session. You have to forgive me. I mean, you can't have these wonderful people as members of the panel and not want to take advantage as much as they can. So I'll move over to Iyanu now to handle the question and answer session. Over to you, Iyanu.
Yes, thank you very much, Akolade. Yes, one plan, one team, one budget, one project. That was such a very insight-filled session. Thank you so much to all the panelists and to Akolade who moderated the session. So we've finally gotten to this session for questions and answers. I see a couple of questions in the chat already. I'm going to start with those. If you can type your question now, it would be good because I'm going to take them in order that they come into the chat. And once we exhaust those ones, I'll take those who have their hands up in order that they raise their hands and their questions will be answered. As some of the text in the chat are actually comments and I would not be going through the comments, I'm just going to be taking the questions that are there, and then the responsible persons will please unmute themselves and answer the question. So I see the first question in the chat from an anonymous attendee, which says, kindly share the comparison of vaccine uptake in African countries and the Western, and what I believe that's like the Western countries, and what challenges were realized, what interventions can be put to realization. I believe the question is to Professor Jonah Musa. Sorry,
oh yeah, so yeah, thank you very much, Yetunji. I've also learned a lot participating in this webinar from all my colleagues. So that question, very interesting question. If you look at the all the data that I showed during my short presentation, you will see that there's a huge disparity between coverage in African region as compared to the high-income countries in the Western world. And in terms of explaining the possibilities, I also look at it in the lens of lack of equity, access, and even the options of vaccinations. If you look at, like in Nigeria, we had fewer options. If you go, I mean, we have AstraZeneca, and those who may not want AstraZeneca may not even want to do it. But in other climes where they had Moderna, they had Pfizer, all sort of vaccines, COVID-19 vaccines were available. And I mean, the strategies they put there to ensure that everybody gets access and get immunized, I'm sure probably that may explain the huge disparity. I think those are the few explanations that I have. And I think going forward, probably we should also have such varieties. We should have options to choose which vaccine I believe in because of the cultural perceptions and also the behavior of our healthcare providers in Africa may have also contributed negatively. You know, so I cited this example. I know of a very nice professor who was busy feeling, no, look, why are you going to take COVID-19 vaccine as if you are not a scientist? You know, so if people have those type of negative influences, you know, it could contribute. So, and then there's this also negative perception that the Western world designed this virus, and probably if you take the vaccine, it's going to just wipe away Africans, you know. So those are the factors. So in summary, it's lack of equity actually, and disparity in access, even in understanding what the vaccine is all about. You know, they could contribute. Thank you.
Thank you very much, Prof. Somebody asked if they would be able to get a presentation slide. I don't know if you want to say something about that, Prof.
Yes, sure. I will send the slides to Dr. Gbemi-Shola,
okay,
and you can share it to whoever wants it. Yeah.
And does the presentation have like your contact detail in case they want to reach out via email or something?
Sure. My email and telephone numbers are there. Thank you.
All right. Thank you so much. I believe this question is to Dr. Usman. Professor Usman Gebi. And the question is, how do you ensure, and that's from Felix Okelo, how do you ensure there is proper utilization of financial management provided has achieved its mandate?
Thank you very much for this very interesting question. I'll tell you, it's like this is again work in progress for all countries, particularly in developing countries, in terms of issues of transparency and accountability. But as some of our colleagues on the panel has shared, learning from polio in Nigeria, we have tried as much as possible to track and ensure that people perform what they are paid for, and actually they deliver vaccines and the jabs at the right arms. And there are many strategies that we followed, including physical trackings, sometimes some electronic models that as you're there, you communicate. We can actually, by GIS, track that you are there. And we have worked out immunization times, how much it would take, how much time did you spend. So there are various things. Of course, it's never perfect, but we keep on learning from the many things that we're doing. But most importantly is that if we have a written plan and it's as much as possible at some level is electronic, it allows easier monitoring to make sure that your resources are put in the right place and the money is used to buy the best buy for the resource for the benefit of the people. I think that's all I'll say for now. Thank you.
Thank you very much, Prof. If any of the facilitators or presenters can answer any question that they know is directed to them by typing the answers, that would really help us to maximize the time. I see Dr. Adejoke Kolawole is already doing that. Thank you so much. This next question came up during the panel discussion, and it's from Aruna Hamza. If we go out with COVID vaccine during routine fixed outreach session and other SIAs, where do we document the COVID-19 data? As there is no provision in all RI tools, and there is no assigned personnel trained within the routine team to report data to the EMID. Thank you, and I look forward to getting your feedback. I don't know if anybody who participated in the panel discussion wants to talk about reporting, as highlighted in the question.
Okay, thank you. Let me attempt that. So I think, like we mentioned, we're transitioning EMID into routine immunization, and all that is being captured under that. For now, you still have your COVID-19 data tools, which you can use to record that. So please go along with all the tools that you have for recording and record that while we are transitioning into that. Even at the national level, the NHMIS is also working to integrate all health data so that once you open all the data, you can fill it into one box and you don't have to be using various tools. So this is what is going on across the country. But for now, please just use the assigned data tools that are already available for that. Thank you.
Thank you, Dr. Kolawole. The next question is, I believe it's also to either you or to Professor Musa, and it's also from Felix Okelo. Prof, what delimitations do we get on proper implementation of primary health care to achieve the universal health care in the near future? I might have directed that question wrongly, but I don't know if anybody can answer that. Maybe it's either to Prof. Gaby or Prof. Musa.
Okay, maybe if I may take a first bite.
Okay.
Basically, again, globally, there's a new kind of push to really strengthen primary health care as the bedrock of the support to ultimately move towards the universal health coverage. You must start somewhere. And that, based on many of the models that have been analyzed, will give you the best buy in terms of what you can deliver. Now, of course, this is a journey. A journey. It's not something that kind of starts and you say it ends at this time. And then as you learn lessons, you kind of reintegrate these lessons and remodify your strategy towards achieving this. But we feel that there's no, this is a right step that has been proven in many places and is a right step in the right direction. I think that's where I'll stop. Maybe if Prof has something you want to add.
Thank you very much, Professor Gaby, for that. I completely agree with you. You mentioned something in the panel, during the panel discussion, that is very critical for implementation of primary health care as a bedrock for universal achieving universal health coverage. The issue of insurance. I mean, if we utilize the tool of health insurance, honestly, is really going to improve healthcare outcomes at the primary healthcare and even nationally. Because proper implementation of health insurance coverage will promote all the preventive health promotion services, which currently, is not given very heavy attention. So one of the limitations I see is the lack of proper health insurance coverage, particularly at the grassroots, including primary healthcare. So that's the only thing I think I will add to what Professor Gabriel has said. Health insurance. If we use health insurance very well, honestly, most of our healthcare problems will be sorted out, and the secondary and tertiary healthcare levels will face less burden. Hospitalizations will go down, and we'll have a better healthcare system. Thank you.
Thank you very much. I have to come to a hard stop at 5 minutes to the end of the of this session, so we have just 4 minutes for the question. I see the question from Bala Abubakar, but I don't know if that's a question or a comment, so I'll just move to the next one. From anonymous attendee, how are we planning to bridge the digital divide when it comes to real-time data reporting of immunization, having in mind there are areas without internet access? So if you can answer that question within like 1 minute, so we can cover the rest 2 questions.
Adeka, do you want to answer, or do I answer?
No, you can go ahead, ma.
Yes,
you can go ahead, ma.
So from our initial experience when we rolled out EMID, yes, we know that there are areas that have no internet access, that is the remote areas. But what happened was that after the teams have finished the data entry, they save it on their phone, and then at the end of the day, they go to the LGA headquarters. So we realized that there's no LGA headquarters in this country does not have one form of internet access or the other this day. Is either MTN is stronger, or MTN is weak, is Airtel they are using, or is Glo or 9 Mobile. So that was the instruction we give to the team members. Save your work on your phone, and then at the end of the day, you go to the LGA headquarters and you send it. So that was how we were able to deal with areas that had no internet access. And I think moving forward, when we start using the RIMID, we are going to be telling them the same thing. And we are even thinking of how we can be using the USSD code for reporting the data. And the USSD code will be made interoperable with the DHIS2, with the EMID, so that once they use USSD code to record the number of children they have vaccinated, they will send it, and then it will be interoperable with EMID, and we'll be able to see it on EMID. The agency is working on that. Thank you.
Thank you very much, Ajia. The next question is from Frederick, and we have just 2 minutes to the end of question and answer. From Frederick Omiti, what have been challenges in integration of new vaccine and immunization of re-emergence of immunizable diseases scheduled into routine vaccine schedule?
I think maybe let me attempt to answer that. So generally we know that coverage of routine immunization vaccines in Nigeria is low, and that's why the country has been had an emergency team that was created to be able to drive uptake of routine immunization vaccines. And like the data showed, and that's when we improved from 33% to about 57% for Penta-3 coverage, and that was within 3 to 4 year period. So we're still working on that. And we need everybody's help to continue to spread the message across that vaccines are safe. They are available at the healthcare center, and that they should please go and ensure that they are fully vaccinated with the vaccine. So if everybody does this, we will not even be having all these outbreaks that we're having, because we would have been properly protected and would have reached our herd immunity. So the thing is, we need everybody. So we need the engagement and the message to keep going out. And like I said, everybody here on this platform is an advocate that vaccines are available at the healthcare centers, primary healthcare centers, even at tertiary hospitals. They have vaccines for routinization, and that's available for them to go and take their vaccines so that we can achieve herd immunity and sustain that herd immunity as a country. Thank you.
Thank you, ma'am. So I think this final question, and because I'm just interested in implementation science, and I think it's integral to what we do at Sydani, I think the question is to Prof. Musa, and it says, how can we make implementation science to become a mainstream research in Nigeria? And that's the last question.
Yeah, thank you very much. I think it's training and also helping the policy makers to understand that no matter what we do, if we do not understand the science of implementation, then all the evidence that's being generated will not produce any societal impact. So advocacy at the policy level, making politicians, government, and all the policymakers to see the need to be trained in implementation science. And this also will involve even the policymakers to understand what implementation science is, and to see the value of investing in that area. Because if we approve, policies, huge budgets, and you just start implementing, and then later on you begin to see a lot of barriers that should have been addressed. At the end, you now find out that you have wasted so much money. So we have to look at that aspect and take it seriously and make it a national priority. And if we do that, then at every level, we'll always ask ourselves the implementation question. What are the strategies? What are the determinants for success, the barriers? And if we try to address that, then we will save a lot of economic losses on some of the projects that we just start implementing without doing any such analysis. Thank you.
Thank you very much. So I'm going to hand over to Mr. Sunday Atobatele to do the closing remarks and to thank everybody who has attended or participated in one way or the other. Mr. Sunday Atobatele is a principal at Sydani Group. Hi, Mr. Sunday, over to you.
All right, thank you very much, Ian. And good afternoon or good evening, everyone. First, I'd like to appreciate everyone for taking the time to join the session. I think it's really interesting to see people stay true from the beginning to the end. I was paying attention to the people that we have on the call. So thank you so much to everyone for joining. And then to the panelists, sincere appreciation to you for accepting the invite to share from your wealth of knowledge, and also taking cognizance of your busy schedule. So thank you so much for your time. And it's been nice listening to you all. It's really a pleasure meeting you, Prof. Usman, or Prof. Jonah. And hopefully we get to again engage after this. So everyone that has joined, listened in, asked questions, contributed in any way, we say thank you very much. And I noticed there are some questions that are still in the chat box. So as much as possible, we'll try to respond to them. And the ones that have not been addressed on the call, we'll definitely make sure that we address them before we jump off the call. So thank you very much, everyone, and have a great evening.
All right. Thank you for attending. Thank you so much. And we hope that we'll see you again when we have something like this. As Mr. Sunday said, if you can just stick around to see answers to all the questions that you have asked, we'll still trying to type answers to them. And if you want to reach out to the Sydani team, we have our website, sydani.org. And I believe that the materials that have been used in today's presentation may be shared with those who are interested, and you will get a chance to reach out to any of the presenters or panelists, so to follow up with further conversation and collaborate to do things. Thank you so much. God bless Nigeria.